Dear parents, myself Dr. Farhan Sheikh, Consultant Pediatric Intensivist at Rainbow Children's Hospital, Banjara Hills, Hyderabad. Today we are going to discuss with you few things about dengue fever, because now the monsoon is approaching, and as we know, the mosquitoes are going to be there because of stagnated water, and these mosquitoes, when they bite, they can always spread infections like malaria, dengue, chikungunya. Dengue is an infection which is caused by dengue virus, and there are 4 main types of dengue viruses: dengue 1, 2, 3 and 4. Recently, dengue 5 virus has been also detected. As of now, there is no vaccine available for dengue infection. Most of the times, dengue infection is not so severe. 95% of the times, there will be only mild to moderate or high grade fever with some rash on day 3 or day 4 of illness, and most of the children may recover either just after the fever or rash, or there may be some drop in the platelets, and then they start recovering on their own. In our blood, there are 3 things: red blood cell, white blood cell and platelets. When we get a small cut on the skin, we bleed, and within 2 to 3 minutes this bleeding stops because of platelets. Normally, platelet counts are supposed to be between 1.5 lakhs to 4 lakhs per cubic millimeter. In dengue, the platelets will fall, and usually they will recover on their own from day 6 or day 7. So most of the times, the infection is not going to be severe. But in some cases, I would say around 5% cases, dengue can be very severe, particularly in children less than 1 year of age, or children more than 8 to 10 years of age, or those children who are very obese. In those children, the risk can be higher. So in those patients, when the dengue is a severe dengue, there can be very high grade fever, severe abdominal pain. Within 2 to 3 days of illness itself, the child will develop coldness of hands and feet, which is an indication that the blood pressure is falling, and the platelets also will fall very rapidly. So if your child is having these symptoms, then this means there is an indication of a severe dengue, and you need to rush to a place which is more equipped and better equipped in managing severe dengue. However, when the dengue is severe, it can lead to a lot of complications like accumulation of water in the chest, accumulation of water in the abdomen because of leaky phase of dengue, or it can lead to multi-organ involvement in the form of kidney failure, liver failure, or it can involve the brain also. And all such cases require expertise and expert team of skilled doctors and nurses who can manage complications of dengue. Make sure that you are approaching to a place which is equipped in such things for management of severe dengue. Once the infection is cured, because during the management of severe dengue, you may also require blood products. And after all these things, when the child starts recovering, usually during recovery phase again, they require a lot of close monitoring to avoid any fluid overload, and eventually, usually by the end of around 8 to 9 days, even severe dengue most of the time settles down. In some rare instances, there can be complications and they may require longer hospital stay. So stay safe by avoiding stagnated water around your house. So apply mosquito repellents to your children before you send them to school. And the moment you see any fever with rash, approach your normal, regular pediatrician. And when you feel that there is a severe dengue, which I already explained, then you need to make sure that you are going to the right place which is equipped to manage such severe cases. Thank you very much.